Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Velody, and we have multiple guests on this podcast to talk about such an important topic as we're going to be talking about joint and skeletal issues in Down syndrome, but we're also going to talk about exercise and how that might help. And we've got some really, really special guests on the podcast today that I want to go ahead and start off with some introductions. Let's start with you, Sarah. You've been on the podcast before. Let's start with you. You share your introduction, and then you can decide who goes next after that.
Thank you so much, Dr. V. My name is Dr. Sarah Mann, and I'm a physical therapist in Colorado. And our clinic, Mann Method Therapy Network, we specialize in working with individuals with Down syndrome across the lifespan. And today we're so lucky because two of the most awesome coach ladies are with us today to talk with you about bones and joints and physiology and all the things you need to know. So, Coach Helen, would you please introduce yourself to the crowd?
Yes, you can. So, hi, I am Coach Helen. I am 23 years old. 23 years old, and I live in Colorado. I love family vacations, dancing, and working out with friends. I love to travel and spend time learning new skills with my cousins. I was 2023 Global Down Syndrome, the beautiful, be yourself fashion show model. I love all kinds of family gatherings. I have two big brothers who I love to teach, and my sister-in-law is best friend. Hannah is my best friend. We met the first time in person at the National Down Syndrome Conference in Orlando in 2023. We were able to have girls getaway with our mom this spring in Hilton Head, South Carolina. It was so much fun. I love Jesus and enjoy my special Sunday school class at church.
Coach Helen,
Thank
that was
you.
awesome.
Good job, Helen.
Okay, Coach Hannah, would you like to introduce yourself to the podcast?
Of course, my dear. Thank you, Coach Sarah. I'm honored to do it. Thank you. So, hi, I am Coach Hannah. I am 25 years old, and I live in Alabama. So, here are four things about you to know about me. So, first, I love singing at karaoke parties. Well, I sing my favorite Christian songs. I have learned online watching YouTube videos, and I want to be a singer and actress. And my second question for you, Doctor, I have been working out with Coach Sarah. I've made Method PT my study program. Graduate plans for 5 years. I love my workout plans. So my third is my dream is to one day I'll be an exercise coach and fitness trainer. And Coach Sarah encourages me to reach for that dream. She calls me Coach Hannah. Once a week, I coach three of my lady friends with Down syndrome through an online Zoom session. We have been working out together for 3 years. We are awesome and stronger. So, fourth is my fifth year as assistant Coach Sarah and Dr. Tessa at the NDSC convention this summer in July. And I love helping them teach about the importance of the BT-based exercise program and coaching and youth adult sessions. I volunteer at Team Ministries and Providence Method. I'm session assistant. Very important.
Wonderful. Wow. You guys are busy. My goodness. Coach Hannah, Coach Helen, and of course, Dr. Sarah. Thank you for joining us on this podcast today. I have had Dr. Sarah on the podcast before, and she has a lot of energy, but I had no idea that she had two coaches with just as much energy as she does. So
Yep, she's my
it's
favorite coach too. I
Oh,
love coach.
good. That's good. Well, today's podcast, we're going to be talking about some of the issues with the bones and the joints and the muscles. And so, Coach Helen, can you give our audience just an overview of what it is that we're going to be talking about today?
Yeah, I will. Um, Today we are going to be talking about muscles and bones. But first, let's talk about how people with Down syndrome are built. People with Down syndrome have unique physiology. Before we get started, we need to understand unique physical, mental, and motor characteristics of people with Down syndrome. When it comes to muscles and bones, people with Down syndrome have flexible ligaments, flexible joints, low resting muscle tone, and flat feet.
You're killing
Yeah.
it. Good job.
Yeah, that was great. Thank you so much for giving us that overview. Dr. Sarah, let me turn it to you. Tell us a little bit about an overview of kind of what to look for, what can be done for the variety of different muscle and bone issues that we were just introduced to.
Thank you for asking, Dr. V. And Helen,
Yeah.
awesome job for giving us that overview.
Yes.
So, people with Down syndrome are built so uniquely. It's really special because their ligaments, those structures that connect bone to bone, are very flexible. So those ligaments are really bendy. So when you think of your favorite people with Down syndrome, you might think of how they can bend with their hips and their knees and their back and be very flexible. With that flexibility, it leads to a lot of different changes that can occur at every single joint in the body. So some of that may look like people are just moving differently or moving slower or having a hard time controlling their body, but it really could be happening on the inside with those muscles and bones at the joint. So what I love is for people with Down syndrome, like Hannah and Helen and their families and their providers and their exercise coaches, I love for them to know about what's going on and what to look for so that we can support people even better. So knowing what's going on at the muscles and joints, what we call the musculoskeletal system, knowing what's going on can help us provide better care and increased access to specialists like physical therapists or orthopedic doctors who may need to help. So it's really important that we know about these things. So I want to talk to you about just a few really important areas of musculoskeletal conditions that are common for people with Down syndrome that you may not know about. It's not usually an emergency like, oh no, what should we do? But it's an opportunity to think about how your person is moving and how we can help them move better by getting them good care. So the first thing that I want to talk about is scoliosis. So scoliosis is where your back, your spine, has a little more curve to it. For people with Down syndrome, because of that ligamentous laxity, because of that flexibility, the back can move a little bit more. So we have a higher prevalence. That means it's more frequent for our people, a higher prevalence of scoliosis. So for people with Down syndrome, of the people that I know, about 50% of them have scoliosis. You might think, well, what does that mean? It means that you might stand a certain way, or that you might lean a little bit a different way. You might be a little more flexed over, or it might even look like one hip is higher than the other, and you kind of walk with a wobble. What's really important about scoliosis is that it's easy to diagnose. You can get an easy x-ray that tells you what's going on. And then you can do specific exercises that help improve your scoliosis and prevent progression. So it's really important to me that for my friends who have a high likelihood of having scoliosis, that we get it diagnosed and that we get good exercise to help with it. All right, I'm going to talk about two more things, and then Coach Hannah and Coach Helen are going to help us talk about a really important one.
Okay.
Okay.
It's very important.
It's very important. My second thing, so first we talked about the back. scoliosis. The second issue that's very common for people with Down syndrome are changes at the hip. So the hips, man, those are our weight-bearing joints. They're so important. And again, because of that ligamentous laxity, people with Down syndrome are more flexible. So we often see that they're able to use their hips in a variety of different ways, a lot more movement and moving around that can wear the joint out faster. So while the research, the literature that's out there may not tell us like exact numbers, in our clinic, again, we see about 50% of our patients have some sort of hip impairment. And it can be a lot of different things. It can be the hip joint just moving a little bit up and down and creating a sense of tightness or pinching. Or even over time, that hip joint moves more and more and can actually move out of place with something we call hip dysplasia or hip dislocations. Now, you may see this with your family, with your loved ones. You might see it as a change in walking, a change in sitting, and sometimes reporting pain. As you know, many of our friends with Down syndrome, they are really tough. And so they may not tell you that things hurt because it's just the way they're used to it. So because, again, hip issues are so common for our people, I really like to encourage that you get at least x-rays at least once a year or every other year that look at where the hips are, because that changes in hip position can happen as early as your teens and into your 20s and 30s. And it makes a huge difference with how your body feels, how you walk, how you run, and how you can do your work and how you can do your sports. So those hip issues are also a really important and really common issue in those musculoskeletal conditions. The third musculoskeletal condition that I would love everyone to think about is called patellar instability. So it's where your patella is your kneecap. And patellar instability means that your kneecap can move out of place. Again, because of that ligamentous laxity, the ligaments that connect around the knee are very bendy. So it's very easy for a person with Down syndrome for their kneecap to move side to side. It's supposed to have some movement, but not that much movement. And so the literature, again, says that maybe like 1 to 8% of people with Down syndrome have this patellar instability. But in our clinic, it's more like 30%. And what you might see is that, say, one day you're walking or you're going to the restroom and you're sitting on the toilet and ouch, ow, ow, ow. That knee really hurts. You can't stand up. You fall down. It hurts so much and you heard a pop. Now, for our people with Down syndrome, it usually pops back in because of the flexibility. But it really hurts and it's really scary. And it can affect how you move. So if you have a loved one with Down syndrome and you've seen that, like that falling, that crumpling, that pain, the pop sound, like it was a pop, and it goes back in, that's wonderful. But that's a sign to us that we need to pay attention to what's going on with the knee. Maybe talk to your doctor, get imaging, because you can see some remains of when the knee goes out of place. And then talk about getting strong physical therapy care, and maybe even talk to an orthopedic surgeon if it keeps happening, because that really can impact our life. So those are my 3 really important things I want you to think about: scoliosis, hip issues, and knees. And now, Coach Helen, we need to talk about my number 1 favorite thing. We got to talk about feet.
You go, Helen.
So for people with Down syndrome, again, because of those flexible ligaments, most people with Down syndrome have flat feet. So Coach Helen, can you tell us a little bit about flat feet?
Yes. It says, now let's talk feet. These are common feet features for people with Down syndrome. 91% of people Down syndrome have flat feet, laxity. It is also very common for us to have increased heel tilt.
Oh, that is so good. Coach Hannah, could you tell us a little bit more about feet?
Well, of course. Well, thank you. Thank you, Dr. Sam. Thank you. I'm honored. So, doctor, I'll tell you, Here are some more common feet I talk about. Feet for features for people with Down syndrome. I can tell you. So,
Okay.
people with Down syndrome, they may have wide base of support or increased foot turnout. That is increased foot progression angle. So they may also have changes in their toes with something called valgus, also called bunions. Or they may have great toe abduction, also called flip-flop toe. It happens with my foot and my joints. If I have no pain, then I'll be just fine, back to normal.
Mm. That's super helpful. Thank you guys. Boy, you coaches, you're bringing a lot of information for us today. I appreciate that. Coach Sarah, did you want to add anything to that, or were you going to talk about maybe even like the walking patterns or gait and how that might change because of this?
Dr. B, thank you for
Yes.
asking. Yes, I do. So, what's interesting is that all these different musculoskeletal conditions, the kind that happen at your feet with flat feet or bunions or the flip flop toe or the wide base of support, the patellar instability, the hip issues, and scoliosis, all of those contribute in every way to how we move, including how we walk. So, one of the things, if you're noticing about your loved one with Down syndrome, if you notice a change in their walk or some asymmetry, that they walk in a certain way that just looks like one side's doing more of the work and one side's not, you might see these things. A different type of walk, a slower type of walk, needing to rest more often. These are common indicators when we see walking that maybe something else is going on in our muscle and joint system. So I know you're thinking about your person with Down syndrome and you're thinking, well, yes, they walk with their feet wide, their feet turned out, maybe their tummy relaxed, their hips tilted forward. And many of my parents and caregivers often say that their person with Down syndrome walks very slowly. I would love to challenge you to reflect when you're thinking about that slower walking pattern.
Mm-hmm.
Do you notice anything else that might be worth looking at with your doctor or with an x-ray that could help understand why we're moving that way?
Super, super helpful. Thank you for that. And I want to make sure our listeners know the prior podcast that I've done with Dr. Sarah was on foot, specifically foot orthotics, shoes that are most supportive, things of that nature. So go back to that podcast, take a listen. I know a lot of people have because there's been a lot of downloads of that podcast. It's a very popular one, but you can get all kinds of suggestions there to help with some of these situations as well when it comes to the feet. Um, what else can be done to help with some of these conditions? Coach Helen, let me ask you, does physical therapy help?
The first time I had PT, I was just a baby. Babies with Down syndrome are very flexible. They also need help to learn how to help their bodies be strong. I had I had a lot of surgery when I was a baby. If you have questions, just ask my mom. When when I was a baby, my PT taught me how to how to get my muscles strong, sit up tall, and learn to crawl and learn to walk. As a teenager and adult, I had PT to help my hips and knees after surgery. Teens and adults with Down syndrome are also very flexible. This does not go away. Sometimes people with Down syndrome develop hip dislocation or knee dislocation and need surgery to make the joint more stable. After 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 I had surgery on my hips and my knees, my family and I worked really hard in PT so I could be strong and do all the things I love.
So, Coach Helen, why is PT important?
Because PT is good thing to do my body because my body helps because because I had a lot of surgeries because it does help me get better. Because I like to work out with Cosette and because and Coach Hannah,
Yeah.
because they are my best people ever.
Thank you, Helen. You're my
So
favorite.
I love that. So Dr. V, that show Helen's talking to you a lot about why getting that musculoskeletal diagnosis is important, because you might need more help. You might need to talk to a specialist or talk to an orthopedic surgeon to get help for that, and maybe have a surgery and then get stronger so that you can do all the things you love. And what Coach Helen is also talking about is one of the things with our exercise and our workouts and the way our team works is that you get to meet awesome people and build friendships so that you can do your workouts outside of physical therapy and have a strong active life.
That's great. What about you, Coach Hannah? What do you think? What would be a good way to set up a good routine to be strong and healthy?
Of course. Thank you, Doctor. Thank you. I can tell you all about it.
Okay.
And so, here are the steps I took to become an exercise routine queen. So, who is strong and healthy? Let's go. So, get good shoes. I love my books of drillings. So, find a routine. In 2021, I participated in a 12-week exercise study with Dr. Tessa and Coach Sarah. We met 3 times a week as a class on Zoom, and could complete 1 hour of our PT-based exercises. It's me and Sarah and Dr. Tessa. We did together from the beginning. We in 2020.
Wow.
And then, Coach Hannah, what are the steps to success?
Here are the steps to success. Thank you, Dr. Sarah. So when our Zoom exercise classes are finished, I kept the routine. So we have our graduate workout class 1 time per week, and Coach Sarah and I meet 1 time per week to work on mentoring, exercise, and coaching. So I led the exercise portion of our ladies' exercise class 1 time per week. I do it every Tuesday night. I complete my Coach Sarah video. I do it every single day. And I walk 2 miles with Mama, and I'm killing it.
Wow.
And I am an example of how doing the routine doctor can make you stronger and ever more awesome.
That's
So
fantastic.
Coach Hannah, can you make it simple for Dr. V?
Of course.
Okay, make it simple for him. What do we need to do?
So, Dr. B, so
Yes.
let me tell you how to make it simple for you.
Okay.
So get good shoes, set a routine, just like me and Helen, that is successful and purposeful. Exercise with friends and family and caregivers. And to find a way to show your passion. It's very important for me for exercise, to be a coach for my dream.
Wow. You are a coach. You are getting me excited to go outside and do some exercise
Okay,
today.
you
My
know,
goodness.
it's good to meet you finally.
Yeah, both of you guys are very, very motivating. Oh my goodness. Well, Dr. Sarah,
Yeah,
I want to make sure that we give you a chance too to suggest if you have any resources for our listeners or if there's any other topics you think we should be discussing on today's podcast.
yeah.
Absolutely. Thank you, Dr. B. Thank you so much for having us and having the coaches, because they really, I feel like, give us they give it the best talk to tell us why it's important to know what's going on with your body and why it matters to take care of it. So I really love how Coach Hannah and Coach Helen shared that. Some extra resources that are super helpful, in my opinion. If you go to the NDSS website, the National Down Syndrome Society, they have a program that's the CARE Project that has tons of excellent resources on all subjects for Down syndrome, but also including a nice, very specialized section on physical activity and exercise. So there's a lot of good resources. You might see some familiar faces and some familiar names in there to help you give more resources there. You can also go to the Adult Down Syndrome Center from Chicago, the ADSC website, and their resource library is amazing. But We're lucky enough to get to work with Dr. Chapoin and their team with a lot of specific articles on musculoskeletal conditions, on balance, on exercises from our perspective that give you the resources right there that you can click on in one link. You can also go to the Global Down Syndrome Foundation to look at the adult guidelines. That's really important. You should hopefully see some exciting updates coming in the next few years, specifically about musculoskeletal conditions. As always, you can reach out to your doctor and tell them that you are listening to Dr. V's podcast and you're wondering, should you check on your person's back and their hips? It's very simple, low X-ray exposure, and gives you a lot of important information that can increase access to care. So there's a lot of great organizations that have resources that are available. If you want specific ones, feel free to email. I love to talk about articles and send you extra. But those are some great places to go that give you some good detailed, more information than even what Coach Hannah and Coach Helen have presented today, and will help guide you on next steps that you might need for your person.
Wonderful. Thank you. Yes. And we just recently had a podcast with the NDSS on their Care DS program. So that was wonderful to hear you mention that. And also Dr. Tessa was just on the podcast as well. So it's like you guys you're reading my mind in terms of things that people are asking about, things that we're being able to cover on the podcast. Well, listen, I loved this podcast. You guys were so fantastic. Coach Helen, thank you so much. Coach Hannah. My goodness, you did such a great job, both of you. And Coach Sarah, oh my God, Dr. Sarah. I don't know. Are you Coach Sarah or Dr. Sarah?
Officially, I'm a Dr. Sarah, but I just hang out with coaches. We just coach them. So Coach Sarah is my real name.
5 years.
Well, thank you all so much for coming and answering these great questions for us and being able to give us more information on this important topic. And for our listeners, if there are other topics that you would like to suggest that we cover, or if there are things that you want to hear more about that we haven't covered in a while, send me an email to downsyndromecenter@chp.edu. And if you'd like to give and be a part of what we do here at the center, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.